Hello, everyone, and welcome to today's press conference. My name is Salah Shader from the Ontario Health Coalition, and we're here today to hear from community leaders regarding the healthcare crisis that has unfolded in their community in the Northwest. Hospital, EMS, and primary care services are at risk in northwestern Ontario due to a funding dispute between the physicians and the Ford government and the worst staffing crisis the province has ever seen. This meeting is being live streamed to Facebook and via Twitter, in addition to being recorded on Zoom. We will have a Q&A session with the media on the Zoom after very brief statements from the speakers. For media members that are on the Zoom that wish to ask a question during the Q&A portion, please indicate in the chat by writing your name and media outlet. You don't need to write your question, as we'll call on you to ask your question during the Q&A portion. We'll repeat these instructions during the Q&A portion, but that's just so everyone knows during the Q&A portion, we will call on you to ask your question. And with that, I'm going to pass it over to Natalie Mera, who's the Executive Director of the Ontario Health Coalition. Natalie?
That's great. Thank you, Salah. And we're going to do speaker view, right? Okay, perfect. So thank you very much for being here. We wanted to do this live, actually, but the problem was we just could not get flights. They were sold out for this morning, so we weren't able to get people in. So we're doing it by Zoom today. In the chat, Lana, could you please paste the names and contact information of the speakers? So we'll have the cell phone numbers there for you, for the media, if you want to contact any of the speakers directly for interviews following up. So just in brief, the situation is very, very serious indeed in northwestern Ontario. In Rainy River, all of the physicians in Rainy River have announced that they are resigning. They're leaving. 2 of the 3 at the end of September, and the other will stay till November to provide some coverage, but that's it. So that's all of the physicians in town. They provide the services at the Rainy River Clinic and at the hospital in that community. In addition, so the hospital in Rainy River has had some emergency department closure period, and the hospital has made a commitment to try and keep the emergency department open. And we're not trying to alarm the community unduly, but obviously this is a very, very serious threat to access to healthcare and people's health in Rainy River and the region around it. In addition to that, they have announced the closure of the EMO ambulance, the paramedic service from EMO, because of a critical staffing shortage. And so at this point, the distances are really ominous. From it's at least 50 plus kilometers from Rainy River to EMO. That ambulance dispatch, that service covers the whole region around EMO. And then it's from Rainy River to Fort Francis, which is the next hospital where people would have to go if the emergency department were to close. In Rainy River is more than an hour drive in good weather. And so it is alarming, the distance between Rainy River and any other service that people would need to access. So what's at threat here? Well, primary care, that's access to family doctors, the front door of medicine, is in immediate peril in Rainy River, and the hospital as well, because all the doctors are leaving. They have had a temporary reprieve but it's just a Band-Aid measure in that they will, the province has extended funding for locums. That's like temporary physicians that would be brought in from out of town till November, but that's it. The funding ends in November, and there is no plan after that. So just to run through the community, what this means for the community, what's happening in the community, and the response. I want to first introduce to you Mayor Deborah Ewald from the town of Rainy River. Go ahead, Deborah.
Thank you. Can you see me? Yeah, okay. Yes, I'm Deborah Ewald, the mayor of the town of Rainy River. This is a very, very terrible situation that we find ourselves in. We were notified through a Facebook post from the Dr. Joseph Ennett, he's sort of the head physician of the group that is working here now, that they were discontinuing services. Like as you've said, like 3 of the doctors are done at the end of October, and he will stay on just to do the clinic area until the end of November. And then we have there's no one scheduled to come. Riverside Corporation out of Fort Frances is the main office for the hospitals here. Like there's ourselves and Emo Hospital and Fort Frances that belong to this corporation, and their recruiter they've managed to fill most of the spots with just temporary physicians to come in, and like locums to come in, and we're good, I think, until the end of November, and then we don't know what's going on there. The town itself has not had, I was at AMO probably a month ago, and I raised the issue of what's going on with both paramedics, with the paramedic service, as well as coverage, because we knew that the doctors were burning out. So it's been a slow thing, and unfortunately we're a small area. It's sparse population in terms of the whole entire district is only like 21,000 people. And in the town, the hospital in Rainy River actually covers 2 First Nations to the north, the townships of Lake of the Woods, Dawson, and Morley, as well as the town of Rainy River. So it's a vast area of travel to go anywhere. From Morrison, for example, which is Lake of the Woods, in the wintertime, it can take up to 3 hours to go from Morrison to Fort Frances Hospital if the ambulance needs to take them there. And we've had closures of the doctors have just closed the emergency, and the paramedics the situation with paramedics is not good. Malcolm can speak more to that later, but I'm also the chair for the District Rainy River Services Board, which oversees the ambulance and all the social service programs. And it's just an ongoing, it's just a terrible, terrible thing that's happened, and there needs to be some significant changes in order because otherwise people are going to die. It's that dire. I'm not sure what else I can say at this point. We have yet, I'm waiting to hear back from the ministry with my CAO. We're supposed to be having a meeting either this afternoon or Monday. So to find out more for like the primary care, which is the clinic part, because Riverside really has they have no jurisdiction over the clinic. That was run by the doctors. The clinic is owned by the town, but it's run by the doctors themselves. And that's caused a major issue. So, and Riverside has guaranteed to cover, like I said, the doctors at the emergency room until the end of November. What goes on after that, we really don't know. But we have a very senior population in this community as well, and people are afraid. They're nervous. It's just not a good situation. These people have lived in this area their whole lives, and now they've paid their fair share of taxes and everything. And now all of a sudden, when they're in their old age, the healthcare is kind of being pulled out from underneath them, and they need sustainable healthcare that's going to be there for them when they need it.
Okay, thank you very much, Deborah. And I think we may get into with questions and so on a little bit more of the lack of response and sort of very belated response from the provincial government after. I'm going to turn it over now to Malcolm Daly, and Malcolm is the president of the paramedics and hospital workers in that area. The union is called CUPE Local 4807. And Malcolm, please go ahead.
Hi, as Natalie said, yeah, I represent the paramedics and the hospital workers, a bulk of the hospital workers in our district. I'm a paramedic myself by trade, so I'm tied to the issue quite dearly. We are just at the tail end of an ongoing struggle right now with staffing, and we've reached a crisis point. You know, I've framed it in the past as that we're no longer treading water and we're starting to drown. Our paramedic service, to speak specifically to that, has had at least multi-years now of very, very limited recruitment and retention strategies. No new paramedics are really joining the workforce, while existing paramedics are exiting, either to seek career opportunities in the same field elsewhere or to leave the career altogether. In the region specifically, and Deb did a good job speaking to the Rainy River crisis with the physicians, our access to healthcare has never really been lower. And I say that as a healthcare worker, a representative, and a citizen, that the access is ever decreasing. Staffing shortages is the primary and major pressing concern that's at the forefront right now. And Deb mentioned this as well, but we have reached a point where the administrating body of our paramedic service has decided to close an ambulance base in one of only 4 communities where ambulances are offered across a major, vast geographical area, resulting in not only the town of Emo, but multiple other townships, Barwick, Chapel, 2 First Nations communities, Rainy River First Nation and the Catchaweenan First Nation, as well as multiple industrial sites, having their access to emergency pre-hospital care increased by 100%. I mean, we're talking about doubling the time that someone has access to paramedic services. So we have this situation where our current staffing levels and our infrastructure isn't designed to meet the needs of the community. And as a result, we're having further staffing crisis due to burnout. Our paramedics are putting in astronomical amounts of overtime, up to 50% greater than a full-time work hours annually. And they're starting to fail and to falter. They're doing this to keep the services available, but our existing workforce is just not sufficient to maintain the services that our communities need. Traditionally, areas in northwestern Ontario, paramedic services, we relied on an overflow of paramedics from southern Ontario coming here for work. But as we all know, with staffing crisis as it exists across the province, there's no one coming. And so we're here alone with the resources we have, losing more and more, unable to retain the workforce we have, let alone recruit more. And we have paramedics, nurses, healthcare aides, maintenance and dietary and housekeeping staff at our hospitals doing everything they possibly can to keep these facilities open and operating, and we're still losing them.
Okay.
We're quite literally running ourselves ragged.
Okay, thank you very much, Malcolm. Thank you for that. And there is no reprieve in sight. There's no solution in sight for the paramedic crisis in the Northwest. Okay, Jules is gonna, so I'm gonna introduce you to Jules Tupker. He's the co-chair of the Thunder Bay Health Coalition, and he's gonna kind of give an overview of what's happening in the region. Go ahead, Jules.
Thanks, Natalie. Yes, our Thunder Bay Health Coalition, as the name implies, is just for Thunder Bay, but we've been getting more and more input from communities around northwestern Ontario. So, and we're looking at the situation, and clearly the situation in Rainy River and in Emo are 2 areas that we're very, very concerned about. But it's not just Emo and Rainy River that have a problem. The hospital in Kenora is also struggling. They at one time had 20 emergency doctors in the hospital. They now have 9. The mayor of Kenora was not able to join us today because he was out of town, so he couldn't join us. But he was going to join us and tell us the situation that's happening in Kenora, and it's just unbelievable that the government is allowing this to happen. And what's happened, as Deb said and Malcolm said, this is not just all of a sudden that happened last week or last month. This has been building up. You know, the problems have been building up, you know, funding and the care that is being provided has been happening quite a long time. We've, as a Thunder Bay Health Coalition, we've been raising this issue for a long time with the government. No response from the government at all, other than say, we are planning on improving the healthcare in northwestern Ontario. Mr. Greg Rickford, the MPP for Kenora, keeps on promising things are going to change. We're going to make things better. It doesn't happen. It's just not happening. And all we get are empty promises day in and day out. And now you see what has happened. This promises has now resulted in what's happened in Rainy River and what's happened in Emo with the paramedics and the ambulance station there. It's just amazing that this continues to go on. We continue here in Thunder Bay to raise it with our MPs and MPPs in here and in Kenora. And the Natalie Mayer, the Ontario Health Coalition, continues to raise the issue across the province. It's something that has to be addressed, and the government just does nothing to do that. And that's a failure of this government, and I think things have to be done.
Thank you, Jules. So this ends the summer of rolling ambulance closures across northwestern Ontario, critical staffing crisis that's only getting worse, and a situation in which the solutions that are being offered are just band-aids, temporary funding, like what happened along the north shore of Lake Huron last summer, where there's just, you know, a temporary stopgap measure for some short-term funding for locums to come in, but no actual solution to the problem that would stabilize the healthcare services in the region. And this is a major problem. People need to decide about their housing, where they live. If you're getting elderly, you need to be near a hospital that has an emergency department. The distances are too far to be able to travel, even in summer, let alone in winter in Northern Ontario, to another community to access these services. And they cannot continue to simply have a last-minute stopgap measure that isn't adequate to stabilize the services. We need a real answer from the Ford government about what they're going to do to stabilize the services, because people's lives, their very lives, are at risk in this situation. And I'm going to open it up now for media for questions and answers. So if you could indicate in the chat if you have any questions, and we'll go to you. Sala, will you just run that? Thank you.
Yep. So our first question is from Randy Tong of 93.1 The Border. Randy, you're going to receive a pop-up to unmute.
Hi. Question to Deb. I wonder, Deb, any thoughts of, I mean, this is across the Rainy River District, obviously. Any thoughts of the mayors joining together as a coalition and really lobby government for some changes here?
We have been meeting with Riverside, because the big thing is to keep the emergency room in Rainy River open.
Sorry, Deb, just to for everyone,
Oh, sorry.
Riverside is the hospital corporation.
That's correct.
Okay, and
It's the
so the Rainy
hospital
River
that-
Hospital is part of that. Go ahead, sorry.
That's right. That's okay. So the mayors of the municipalities that I spoke of, Dawson, Lake of the Woods, myself for the town, and Morley, we've all met with Riverside. We've had meetings with them, as well as the two First Nations that are located north of Morrison. So we've all met several times, and to kind of put a plan in place. We're using the recruiter for Fort Francis to and they, like I said, they have successfully found enough doctors to fill a temporary gap, but it's the long term that really needs help, because the system is just too old. And I'll just give you an example. So with the contract that existed in Rainy River with these current doctors, there were like three doctors for sure, and one other one that would come in. They would get locums to come. Now their method of working was they would work 1 week, 7 days. In the morning, in the daytime, they would cover the Rainy River Clinic, and then after that, they would cover emergency. So they were essentially working 7 days, 24 hours a day. That was the model that they used. Well, you know, they've been doing it for like over 10 years. Well, you know what? Everyone ages, and I think they just burn out. And I think that's what's happened. I've lived in Rainy River for a long time, and most of the time we had two doctors on. One would cover One would cover the clinic during the day and the other would cover emergency at night. Now, to be fair too, emergency wasn't as busy as what it is nowadays with all the social issues that are going around. And so it is, I think it is a bit busier, but at least you had, when there was anything like or big emergency, then the other doctor would come in as well, so that you weren't alone. With this model, they're totally alone. And it's just not sustainable, as we can see. So, but there again, like the towns that use the services, we have no input in with the Ministry of Health. And as I said, I spoke with at the AMO conference, I spoke with the Minister of Health as well as the Ontario Medical Association representatives, and I explained to them what was going on, and that there needs to be change, and there needs to be a change that's going to make a difference. It has to be updated.
Okay, thank you very much. And AMO, for those watching who don't know, is the Association of Municipalities of Ontario. So they have their conference.
Yeah.
Okay, great. Thank you. Randy, do you have a follow-up?
Yeah, I just had to click all the buttons here to get back on. So I don't know, maybe this is kind of a two-part question, maybe both for Malcolm and for Deb. We have struggled for years to get people to this part of the region, to the point that even the McDonald's restaurant in Fort Frances had to curry in people from overseas to fill positions. How do we get people from other areas to fill the spots that we need if the existing programs that are out there aren't working?
Let's start with Malcolm this time and then go to Deb, if that's okay.
That's a good question, Randy, because it's obviously affecting every industry. In paramedicine, to speak specifically to that, we are at a point where this has become such a widespread provincial issue that the career is disincentivized for lots of people, let alone to have people travel to a remote area where they have no family or connections to come and do the job. It's a very difficult, taxing career, and it involves a lot of give from the worker with not seemingly a lot of return from the industry. So recruitment and retention needs to be focused on building up these positions above and to meet or to maximize above what's available elsewhere. Like, we need to incentivize people to travel here, because unfortunately we're not making it on our own. So as far as like getting people involved locally, like, let's continue building, let's try to build infrastructure and resources locally, but we need to see something done in terms of retention, whether it be increasing or expanding northern living allowances, in paramedicine, just real investment in things like mental health benefits. Wages obviously are always, depressed in these industries. Those are things that are going to attract people, and we've seen that evidenced elsewhere. We've seen other more northern communities increase and attract healthcare workers by offering retention incentives and recruitment incentives. So those are real actionable items that could be done.
Thanks, Malcolm. And Deborah?
Yeah, Malcolm's right. Like, we basically need more money, because I think that's what makes the difference, because people come up here and it's a beautiful place to live. It's not Southern Ontario, of course, but it has a charm of its own. But people come up, and especially if they're from Southern Ontario, they stay for a while, and then they want to go back to where family and whatnot is. So we need a different method for payment for people to do the north. And the northern travel, or the northern that Malcolm had mentioned, that was something that was used for Ontario Provincial Police and different organizations over the years, and it helped a lot for retention and recruitment, because it was a good benefit. It was a good program from the government, but unless it's the far north, I don't think it's available here anymore anyways.
Okay, thank you very much, Deborah.
Yeah.
Okay, next question.
So the next question is from Leigh Noonan of TBT News. You can unmute yourself.
Hi, thank you. And I guess this question is to Malcolm. Malcolm, why the EMS base in particular is because if I understand correctly, that base is actually staffed.
So is it Lee or Lay? Sorry.
It's Lee.
Lee. Okay. So go ahead, Malcolm. Thank you.
Hi, Lee. So we are having ongoing discussions with the District of Rainy River Services Board on the presentation of this idea and how exactly it will roll out. As far as the information that's been shared to the public, the staffing crisis, you're correct, does not affect EMO as directly as it affects communities like Atikokan and Rainy River that fall under that same umbrella. Atikokan is fully staffed. And from a labor perspective, we see the members in Atikokan or in the members in EMO who have, worked and dedicated and built
Sorry, Malcolm,
seniority.
can you just back up? Sorry, you're saying EMO is fully staffed. Is that what you were trying to say?
Yes. Sorry
Okay.
if that was unclear. EMO is currently fully staffed. You're correct in that. We have staffing vacancies, like long-term vacancies in other bases. So by closing EMO base, the intention is that those staff will be redistributed through a layoff process, essentially into the other bases. We have ongoing conversations with the services board that there are details that are essentially closed that I won't speak to specifically, but that's more or less the intention. Deb could also speak to that to some degree as well. So she serves as the chair of that board. So more or less what we see is vacancies across the district, and EMO is being chosen as the base that can be closed because it's perceived that the response won't be limited in a detrimental way, although I disagree. I mean, EMO is in the center of our district in a lot of ways. They don't currently have an emergency department at their hospital. It's been closed for a number of years. By removing pre-hospital care or extending pre-hospital care response times by, doubling them, we've just left that community fully out in the open. Not to mention the New Gold Mine, which is an hour's drive from either Fort Francis or Rainy River. Again, the First Nations communities that I mentioned. But that is the overall rationale, is that they can take those staff members that are currently working in EMO and force them or redistribute them into other positions that exist.
Are
Deb,
these
did you want to? Oh, sorry.
Sorry, I would love to hear your perspective too, but I also are those longtime EMO residents? Like, are these people that want to move to Atikokan?
They're all people that have elected to remain in EMO as paramedics. They would have had the opportunity many times to move to Rainy River, Atikokan, Fort Francis, and chosen not to. EMO base, as far as paramedics go, is staffed with people that live and have family ties in EMO. So that the distress for them is high as well, because they know that they are subject not only to a changing work environment, but they're subject as citizens to an increase in service, and their family members experience that increase in service.
Thank you. Deb, did you want to add anything about the choice of EMO?
Yeah. These are the numbers. We're supposed to have a full complement of paramedics as 46. We are now at 30, at 34. If we lose 2 more paramedics, we can't operate. We don't have the staff to operate, period. So the decision was and it's just a temporary thing. We're hoping that we're going to get more people, or things will evolve if once this gets out, that how short we are. But that was in looking at everything, because and we're aware of how the distances and stuff. So, and it's unfortunate, and that's and Malcolm's right. Like, you want everybody to work and be happy where they're working and to live where they're working, but we have to provide a service, and we struggled with a lot of things, and this seemed, for a temporary measure, to be the situation that would work the best.
Okay, thanks, Deb, very much. Okay, so next question.
The next question is from Michelle Allen from CBC News Thunder Bay, whose mic isn't working, so I'm going to read out their question. Question for Mayor Ewald or whoever feels most up to answering. Could you explain what the funding dispute between the physicians and the province is exactly? What are the doctors asking for, and what is the government offering / not offering?
That's a very good question. First off, we know at the town of Rainy River, we own the clinic, and we've also built a locum house where locums can stay when they come in. So we're supposed to be assigned, so I've been told yesterday that we are still a signatory on the contract, but we know nothing about this contract. The last time that we even signed anything was in 2012, when a previous doctor left, and one of the 4 doctors or 3 doctors that are now on this contract, their name was put as another signer. Okay, and the town itself has no information on what the pay is. I've had conversations with 3 of the doctors, and they tell me what their issues are, but I honestly, from a town perspective, we don't know what, if it is a money issue, how much their contract is. We have a contract that the previous one from 2012 but this one is totally different. And like I said, we're like in the dark, and we were told way back then, because we had some concerns as a community about the services at the hospital and stuff. And we were basically told by a ministry person that just basically shut your mouth and sign the contract, or you won't have doctors. So that's it. And since that time, we have had no contact with the ministry regarding the contracts themselves. We're not a party to them. We have not signed anything with this contract other than the transfer from the doctor leaving to the doctor that was on the contract now.
Okay.
That's it.
Thank you. I just wanted to note something. So this is a funding dispute between all of the physicians in Rainy River and the province, and all of them are leaving as a result of this dispute that is just not being resolved. But this is not the only place in Ontario. The most recent agreement with the contracts with the physicians has resulted in physicians leaving in other places. I'm thinking of, for example, our local coalition, and I haven't verified this, so for the media and for the public, like, this is not, I've not verified this information, but it was reported to me that in, I think it was Midland, the same thing was happening. And in some other communities as well. Rainy River is obviously the hardest hit that we know of right now, because all of them are leaving, and there doesn't seem to be any resolve, and 2 are leaving at the end of September. So it's imminent, and the province needs to tell people what's going on and have an answer for why they can't resolve this with the physicians, who obviously are committed to the community. They've been working there for years and years and years. So, there needs to be some clear information and an answer as to why there is no resolve, and just now a temporary measure which would bring in locums just to November. That's it. And that funding is just very, very short term. Okay, so yeah.
Okay, and second question for Michelle, for Natalie. You said we need sustainable long-term solutions from the province. Can you provide specific examples of policy or funding changes you'd like to see?
Yeah, I mean, this most recent financial year, it hasn't been reported to the public, but what happened was the government actually ran hospital funding at real dollar cuts all year. Their hospital funding that they announced, their planning was 0.5% increase in hospital funding. This in a year in which we've had, leading into it, the most emergency department closures ever in the history of the province, the worst staffing crisis we've ever seen, hospitals having to pay all kinds of extraordinary costs for overtime and for-profit staffing agencies and so on. And then in the 4th quarter of the financial year, so the last weeks of the last year, they announced the hospital funding. So they're able to say, and they say all the time to the media, we're, pouring money into the hospitals and so on. Well, no, actually, for the entire last year, funding ran at less than 1%. Their plan was 0.48, so half of 1%. They increased that, so it was 0.9% in the first quarter. And then it wasn't until like 15 days or so before the end of the financial year that they actually made the hospital funding announcement. Too late to hire staff and stabilize the services. The deals with the physicians, we don't have the details of the contracts with the physicians, but what we do know is that there are disputes around the province that are resulting in physicians leaving. I don't know who's right and wrong in that. I just know that it has to be resolved because we can't lose any more physicians. We have the worst crisis in our history in staffing for healthcare, and it's dangerous. It's resulting in things that actually cause death and risk people's lives in a very serious way and compromise their health for the long term. In the long term, we need stable, multi-year funding that is sufficient to meet population need. So even the hospital funding that they announced at the end of the year was a 10.6% increase, a big increase at the end of the year. Too late to spend it in the last fiscal year, but the government will say that they gave all this money last year. So very manipulative. But in addition, that's for the retroactive wage reopeners. That's for the arbitrated settlement because of the wage cap that they had put on for the 3 years prior. And so most of that goes to fund out that. That will go a decent way towards stabilizing the staffing situation, but it will not resolve it going forward because we don't have any plan to actually fund the hospitals and OHIP physicians at a rate that is going to keep people and have them stay. And because we're wasting just millions and millions, actually more, $1 billion, more than $1 billion on for-profit privatization. So while they're kept the public hospitals at less than the rate of inflation by far, real dollar cuts, they have poured money into private clinics and for-profit hospitals and staffing agencies. And then all the money that's being wasted on overtime and for-profit staffing agencies that could and should go towards a regular staff force that stabilizes the sector. So they have to stop the staffing agencies. They have to do it because it cannibalizes the workforce, and they won't do that. Who knows why not, but they will not do that, and that makes no sense at all. And they won't stabilize the funding. So those two things would matter enormously, and they have to come to a resolve with the physicians. Other than that, we need health policy that supports our local public hospitals and stops the closures and so on, because in areas where you have routine closures, it's impossible to recruit staff. Like, who's going to move to a community where a hospital's closing? That's not going to happen. So the more unstable things are, the more unstable they get. And it's like the paramedics, where you have severe staffing shortages, the workloads are impossible, accidents and injury go up, people end up off sick for more time, the staffing crisis gets worse, they're in a vicious cycle now, and then you can't recruit and retain people because the workloads are impossible and they don't want to do it. So sorry, that was a bit long, but thanks for the question. So I think Randy had another one. Was there anyone else who had a question? So we'll give oh, sorry, no?
Yeah, no one.
Okay, so we'll give the final one to Randy then, unless if anyone else has a question, if you could identify it in the chat. Go ahead, Randy.
Hi, thanks, Natalie. And actually, this question is to you. I mean, you've heard the issues facing Northern Ontario from the individuals here. Different situation in Southern Ontario. So as an organization that you had, how do you bring this to the province to say, hey, we got some real big needs up in Northern Ontario that aren't the same down in Southern Ontario? How do you divide that pie up that addresses what the problems we're having here?
Yeah, I mean, basically, the problems that are happening in Northern Ontario are just much more severe because the distances are so great, but they're also a bit unique. And last year when the province cut all of the special COVID funding for locums and so on, Northern Ontario was particularly hard hit. what we are trying to do, I mean, the reason why we're doing this press conference was to bring, we were going to try and do it physically, but we couldn't, but bring the issue of what's happening in northwestern Ontario directly to the legislature, to the media in Toronto, to the like provincial level media, to the legislature, and try and pour on some pressure to actually get a resolve that's going to work for the community. Just before the summer, we heard about the planned rolling emergent ambulance closures across northwestern Ontario. We were completely horrified at that. And actually, I tried to do a press conference then to raise the issue. But again, the issue of transporting people down to Toronto, so because the local media covers it and so on, but it stays in the local community and it doesn't have the same kind of political power and impact on the provincial government. So we weren't able to get that together before the summer. I feel kind of sick about it, frankly, Randy. I don't think we do enough to raise these issues, but because there should be a spotlight on what's happening in Northern Ontario. It is terrible. It's unprecedented. It's terrible. It absolutely puts people's lives at risk. And now people have to think about whether they have to move because they don't have the health services that they need as they're aging in their communities. And of course, housing is completely unaffordable. It's a really major problem. So, our commitment is to do more. And we tried to do a lot last year on the North Shore, the issues around staffing on the North Shore hospitals, the North Shore of Lake Huron, and we'll continue to try and do things like this to try and pour on the pressure to get a solution for the North that works for Northern Ontario better. Okay, anything else? Okay, well, thank you very much for coming and for staying and for being here. I hope that this results in some kind of resolve. And Deborah, you have a meeting this afternoon with the Ministry of Health, so you may be able to update media after that if anything happens, right?
Well, it'll be either this afternoon or on Monday.
On Monday. Okay. So we'll put out an update once there is an update if anything changes here. And I hope, from the bottom of my heart, I hope that it does. Thank you very much, everyone. Have a good day.
Yeah.
Bye now.